Doctors and medical staff have announced a nationwide protest to be held on Wednesday, followed by a strike starting Thursday. Despite months of demanding higher wages, their concerns have gone unanswered, prompting them to take stronger action. According to the organizers, more than 14,600 doctors and medical workers from approximately 130 hospitals and healthcare institutions nationwide covering primary, secondary, and tertiary levels have officially signed statements declaring their participation in the strike. The number of participants is expected to rise further. The protesters stated that, as the state budget nears approval, no meaningful steps have been taken to address their demands, and no agreement has been reached. Therefore, they will proceed with this nationwide strike, and if necessary, are prepared to submit mass resignations. They also announced plans to deliver a formal petition to the President of Mongolia on Monday. If both the parliament and the government continue to stand against the health sector, our final recourse is to go on strike, and our last hope lies with the President of Mongolia. Today, we will submit a petition to him. The doctors and medical staff warned that a strike could cause severe consequences to human life and health, emphasizing that the government will bear full responsibility for any resulting harm. Only the emergency and resuscitation departments are expected to continue operating during the strike.
World Diabetes Day is being observed under the theme Diabetes and the Workplace. Known as the silent epidemic, diabetes affects millions worldwide, with 7 out of 10 patients actively employed. However, medical professionals note that most lack proper conditions to maintain a healthy diet, exercise regularly, or take their medications on time. On this occasion, health experts urge greater understanding and support for colleagues living with diabetes. As of 2025, an estimated 589 million people globally are living with diabetes. 1 in 3 of them will develop kidney failure, and 1 may lose their sight. Furthermore, 60% of stroke cases, 70% of heart attacks, and 80% of dialysis patients are linked to diabetes. In Mongolia, it is estimated that 202 out of every 1,000 adults aged 20-79 have diabetes. This means roughly 404,000 Mongolians live with the disease, though fewer than 30,000 have been formally diagnosed and registered, revealing serious gaps in surveillance diagnosis and healthcare services. Despite their capabilities, employees with diabetes often face workplace discrimination and lack proper support. To address this, Mongolia is promoting inclusive employment for people with diabetes. The National University of Medical Sciences is providing education and training for patients and employers alike. In Mongolia, diabetes is often diagnosed only after complications arise when it is already too late for effective intervention. Doctors strongly advise those experiencing persistent thirst, frequent urination, or excessive fluid intake, especially if overweight, to seek medical testing and prevent the disease before it progresses.
In most workplaces, there are no designated areas for exercise or for taking medication, and employees are seldom given time off for regular medical checkups. Many supervisors lack understanding of their needs. People with diabetes are fully capable of performing their duties like anyone else, but they require supportive conditions such as access to healthy meals, opportunities for physical activity, and sufficient time to take their prescribed medication properly.